Hello, and welcome to a presentation on my personal philosophy of nursing practice. Commit your work to the Lord, and your plans will be established. Proverbs 16, verse 3. This verse is probably one of those closest to my heart. I lost my father soon after starting nursing school, and it has given me strength to get through a great deal over the last 4 years, if not many challenges in my life. In a way, it is the foundation of my nursing philosophy that if I commit to Him who has given me everything, I will do well and succeed. Nursing is a calling. It's an honorable yet taxing profession, and sometimes a very thankless job. We as nurses are present at the best and the worst times of people's life, and this is really a true honor. I believe nursing is a calling from God. It takes a special individual to answer this call and fulfill the role of a nurse. I believe I have been blessed with special talents and skills, and I tend to use these skills that God has given me to care for others. Many of the principles of nursing can be seen in the life and teachings of Jesus Christ. Loving one another, caring for the sick or the outcast, those are things we were taught. So basic foundation for my philosophy is that I will always use the God-given talents I have to care for others with genuine love and compassion. In Nursing, Scope and Standards of Practice, the American Nurses Association lists the tenets or characteristics of nursing practice. These tenets are the basic core concepts pertinent to the nursing profession. Number 1, nursing practice is individualized. 2, nurses coordinate care by establishing partnerships. 3, caring is central to the practice of the registered nurse. 4, registered nurses use the nursing process to plan and provide individualized care to their healthcare consumers. And lastly, 5, a strong link exists between the professional work environment and the registered nurse's ability to provide quality healthcare and achieve optimal outcomes. While all of these tenets must be on the forefront of a nurse's practice, caring and being able to practice with individuality, bringing compassion and spirituality to the bedside, are those characteristics most important to my philosophy. Bringing the concept of caring or patient-centered relationships to the bedside in order to foster healing are not new ideas, nor are they unique to my philosophy. In fact, caring is the central theme in Jean Watson's theory of human caring. She has been quoted as saying, "Caring is the heart of nursing." Her theory was developed in the 1970s when technology and modern medicine were advancing, and nurses were still seen as doctors' bedside assistants. Nursing, she felt, was becoming too skill and task-driven, and she wanted a way that nursing could stand out and establish itself as its own true profession. It needed its own identity. The following has been said in regards to Jean Watson's theory of human caring. In today's world, nursing seems to be responding to the various demands of the machinery with less consideration of the needs of the person attached to the machine. In Watson's view, the disease might be cured, but illness would remain because without caring, health is not attained. Caring is the essence of nursing and connotes responsiveness between the nurse and the person. The nurse co-participates with the person. Watson contends that caring can assist the person gain control, become knowledgeable, and promote health changes. So as I mentioned earlier, the theory of human caring sought to bring meaning to nursing and began to recognize it as a profession separate from medicine, yet still an extremely important partner. While medicine focuses on diagnosing and treatment of the disease, Watson felt that nursing should treat the complete individual. She felt that the body, mind, and spirit all need healing and need to be attended to. When a nurse treats the person as a whole and is authentic with her actions, what Watson refers to as a transpersonal caring relationship begins to develop. When this genuine transpersonal caring relationship has been established, Watson feels that true healing begins. Two parts of the theory of human caring that are important to discuss are caritas factors and caring moments. The two together are what helps bring about the development of a transpersonal caring relationship. Caritas factors are practice guidelines that Watson developed that can assist a nurse in providing holistic care. When practicing the Caritas factors, a door is opened for the nurse to provide and for the patient to recognize what she refers to as caring moments. Caring moments are basically genuine acts of kindness that a nurse performs while caring for a patient. But they're genuine. Holding the patient's hand, using eye contact, taking time with a patient are examples of caring moments. Again, the two together create a transpersonal caring relationships that she is referring to. It is worthy to note that most nurses seem to care for their patients. A person would not choose to be a nurse if that was not one of their basic principles. But according to Watson, to truly care, a nurse must approach her practice from an authentic, holistic manner. The desire to care for someone must be genuine and a part of that nurse's inner self. To quote Watson herself, a nurse may perform actions toward a patient out of a sense of duty or moral obligation, and would be an ethical nurse. Yet it may be false to say he or she cared about the patient. The value of human care and caring involves a higher sense of spirit of self. Caring calls for a philosophy of moral commitment toward protecting human dignity and preserving humanity. As I mentioned earlier, spirituality is an important foundation of my nursing philosophy. In order for me to be the best nurse that I can, I must first continually feed my own spiritual needs and grow before I can feed the spiritual needs and take care of the health of my patient. Spirituality is about having a higher sense of self, a strong moral compass. And a strong spiritual side is the driving factor behind caring for others in a genuine, holistic, and spiritual manner. I believe that if one's heart is filled with love and they have a belief in some type of higher power, healing is maximized and it creates a more positive mental state. When a nurse and a patient are in a true transpersonal caring relationship, they are able to have spiritual discussions and address these spiritual needs. These open discussions are allowed to happen through the caring moments that Jean recommends. I make every attempt in my practice to take time for my patients, perform caring moments, have spiritual discussions, ask them how they find peace and meaning in their life, and how I, as their nurse, can help them achieve this. One thing that needs to be mentioned, though, is that spirituality and religion are not the same. Many nurses are uncomfortable having, quote, spiritual discussions because there is this fear of talking about religion in the workplace. Spirituality is about meaning in life and relationships to others, possibly a god or gods, and may be expressed in many ways, including music, art, nature, community, family. Religion at times may influence the development of such relationships, but there may also be no religious association. Religion, however, practices include prayer, attending religious services, and being an active member of a religious community. So you can have spirituality and be in touch with a power greater than oneself without necessarily being part of a recognized religion. Points that are important in my practice as well as my life interactions. I believe that people should be treated kindly, with dignity, concern, and respect. Individuals should not be judged by past actions, religious beliefs, or the reason for being in need of care. As a Christian nurse, I will permit Christ to radiate his love to the sick through my practice. I will make every attempt to follow Jean Watson's thinking and approach my practice holistically, considering the whole person, the body, mind, and spirit. I will always try to remain humble and kind, remembering and giving thanks for the gifts that I have. I will respect my environment and use my resources wisely and efficiently. I will collaborate interprofessionally as well as interprofessionally with others, looking for ways to seek knowledge and input in order to enhance my skills and provide the best care possible for my patients. Regarding health, I refer to the following verse from Exodus: I am the Lord that heals you. Without the Lord on your side, I truly believe that healing is hindered, if not impossible. All healing is divine. Unless God's healing power surges through a body, human effort is in vain. God has placed forces such as light, air, food, and drugs into nature to help man. Without the help and strength of God, I will be challenged to bring healing to my patients. So in conclusion, whether in my nursing practice or life in general, I will follow these commands from Jesus Christ. Love your neighbor as yourself, and do to others as you would have them do to you. This is the foundation for my philosophy of nursing, but most importantly, my personal philosophy for living the life of a genuine, caring Christian human being.